UATN industries of all kinds are feeling short-staffed. It's a side effect of America's pandemic recovery. With the labor shortage affecting healthcare, it could spell trouble if you find yourself needing a hospital bed. KMT News 3's Annalise Johnson has more on this special report.
Katie, Mercy One North Iowa Medical Center, like hospitals across the nation, is feeling the pressure of the labor shortage. The hospital is doing what it can to keep areas of service operational and to bring in new workers to relieve the strain.
And we're just really trying to help in any way to try to bring in more candidates, more new hires for those areas.
Megan Quam, talent acquisition partner at Mercy One North Iowa Medical Center, is one of the people tasked with filling the hospital's labor shortage. According to the latest numbers from the U.S. Bureau of Labor Statistics, healthcare added 37,000 jobs in October, but employment in healthcare is down by 460,000 since February of 2020.
We're probably running anywhere from 350 to 400 openings at any given time right now. So quite impactful to our organization for staffing.
Mercy One North Iowa is feeling that gap. The hospital is currently not able to operate at full bed capacity. Nursing is being hit hard, but Quam tells me all hospital areas are being impacted. Workers are needed everywhere, from housekeeping to the labs.
We're having to have our staff float to other areas to staff those areas. And sometimes that's still not enough. So it's just a lot of trying to figure out what area can help this day, and then figuring out what we can do to try to get more people in the door to try to help with that.
Staffing issues led Mercy One North Iowa to temporarily halt accepting new patients at the inpatient hospice unit in late October.
Our COVID numbers got a little bit better, but our discharges slowed down because I think nursing homes are struggling with staffing as well. So we had a lot of nursing homes that weren't taking transfers, which increased our census here at the hospitals.
So where did all the workers go? Mercy One North Iowa tells me it's a combination of the hospitals adding new positions to meet increased patient need and filling positions left empty by workers who terminated.
Trying to staff more because our patient inflow has been higher, and so we need more staff in regards to that. We've opened up some additional areas that then require more staffing for those areas as well. And then just, I think the workforce in general has changed slightly.
After the first surge of COVID, we had quite a few people retire. They're at retirement age. And I think it certainly accelerated their decision to retire.
Mercy One North Iowa just started open interviews on Tuesdays with the hope that convenience, comfortability, and incentives will draw applicants in. Minimal pay is increased to $15, and there are signing incentives for most nursing positions.
We're trying to increase things that we can do to get more staff in the door so that we can get back to that full capacity.
Those open hiring hours are from 4 to 5:30 on Tuesdays. If you're looking for a job, I'll have that link to Mercy One North Iowa's career page on our website, KMT.com. Katie.
Thanks, Annalise. We also reached out to Mayo Clinic. They say, as with hospitals across the country and employers across industries, Mayo Clinic is experiencing staffing shortages. Mayo is working aggressively to make hires to fill those shortages to compensate for not hiring when patient volumes were low during the height of the pandemic.